Welcome to HealthWatch, presented by Novant Health. I'm your host, June Baker. Our show features local physicians and health professionals discussing health topics of importance to local residents. Today, we will have the opportunity to talk with Dr. Lydia Labachetta about a new technology offered at Novant Health Urology Partners. Next, we will talk with Stephanie Shoaf, physical therapy assistant with Novant Health, about the new physical therapy location. And finally, we will talk to Linda Patrone, nurse manager at Novant Health Brunswick Medical Center, about a medical mission trip that she recently returned from. Stay tuned to learn about valuable health topics with HealthWatch. Our first guest today is Dr. Lydia Labachetta, a urologist with Novant Health Urology Partners. Welcome to the show today, Dr. Labachetta.
Thank you for having me.
Well, it's a pleasure to have you back. I know you've been on the show before, but you've brought some interesting information for me today and something new called Greenlight laser therapy. So we're going to talk about this a little bit.
Yeah. Greenlight photovaporization of the prostate is basically a new surgical instrument for doing a surgery that we urologists have been doing for ages and ages. BPH is a kind of buzzword for prostate hypertrophy or prostate urinary problems. And so a lot of guys have overgrowth of the prostate over time that makes it difficult to empty the bladder or that just causes some urinary symptoms. And years ago, when a patient walked into a urologist's office, if they were male and they had a urinary problem, they had surgery. And so since then, the pharmaceutical sales companies kind of caught up with things, and there are now a number of different drugs that are available for treatment. And I think, unfortunately, that some people have kind of forgotten about the surgical options. And this Greenlight photovaporization of the prostate has made the more traditional surgery a lot less, you hate to say less invasive because it is still surgery, but it's now an outpatient surgery that can be done with really minimal risk. Also, patients used to lose a lot more blood with the older surgeries, but our visualization is really good with this, and since it's a vaporizing technology and a laser technology, it actually causes coagulation as we're going, so there's a lot less bleeding, which means that you get to go home the same day.
Really? That's great.
Yeah, it is. I have this video here that I'll play for you, and I think it's kind of self-explanatory, but I'll kind of talk through it. This is a company called AMS, and they make a lot of urologic equipment.
No, is that the instrument?
This is the actual probe that we use, and this wire or the fiber goes in through a scope.
So can you pause that? Right there?
So this is actually the laser fiber that we're using, and the laser energy is deflected, so we have better control so that as we're operating, we can see what we're doing, we can see where the laser energy is directed, and we can see how the tissue is being treated.
Okay.
And so in the operating room, of course, we have the patient completely prepped out. This is the anatomic location of the bladder and the prostate, and we can do all of this surgery without any incisions. So we actually go in through the penis with a camera, and we put our laser fiber through the camera like so. And so this is that same probe that we saw in the earlier part of the video, going through the camera scope.
Okay.
And this is what I see. So from the inside, as I'm operating, I can see where the prostate tissue is, and I can see where the laser energy is being directed, which makes it a very safe procedure because I know that what I'm vaporizing is what I want to be vaporizing.
Looks like it's carving out a piece
It's just like coring out an apple. It really is. And you know, of course, this is an animation, so you can't really appreciate it, but you really do have very good hemostasis during the procedure, which is blood coagulation. And so, you know, if you can kind of imagine the kind of before and after, on the left side of the screen, we have the normal prostate anatomy. This would be the bladder up here, full of urine, and prostate tissue pinching together on the urethra, right obstructing the flow of urine. And so with this procedure, basically we open up that area that you urinate through and create kind of a void. Men oftentimes say to me, well, what happens to it? And it really is vaporized. It disappears.
It's gone.
It's gone.
Okay, and is that the urine, can you show us here on that one? Can you point to how it's carved out?
So we have this carved out area of prostate tissue here. So rather than having a full apple of prostate tissue, we're kind of left with a rind on the outside. And so, you know, when you're thinking about considering, you know, people always worry about nerve damage and blood vessel damage and all those sorts of things, which is reasonable. But all of the nerves and blood vessels that contribute to erectile function and other important things are well on the outside of this inner core of the prostate tissue.
And this might be off the topic, but with the enlarged prostate or this narrowing here, does that contribute to sexual dysfunction, or does it just impact urine?
It really just impacts urine. It does definitely affect ejaculation, which is one of the things that we talk about with the surgery. There are some men who have this surgery and they have recovery of their ejaculation because the ejaculatory ducts go through the prostate tissue. So when you have all of that obstructing tissue there, sometimes you can have it come back. Usually with this procedure, though, I tell guys that they probably won't have ejaculate come out because we're basically coagulating over the area that the ejaculatory ducts are. But in terms of orgasm and erectile function and all of that, that all remains the same.
Okay.
So continuing along, we have a beautifully emptying bladder on the right side. Which is also where I think it's important to understand the preoperative counseling and the preoperative workup that we do, because certainly it's possible to have more than one problem. Sometimes there's a problem actually with the bladder and not just with the prostate. Sometimes the prostate has over time caused damage to the bladder. And so one of the things that we do preoperatively is just try to understand people's voiding function so that we can help predict their post-operative outcomes.
Well, good. That's great information. Thank you so much for bringing us that today. Now, I know you have a new partner, and I'm curious, does he do this also?
He does a type of photovaporization that's based on a bipolar energy. And, you know, I tell everybody this surgery is one of those things that has all sorts of different instruments that can be used to do it. So, and we both do the traditional transurethral resection where there is tissue left over for patients who are concerned about pathology and things like that.
Great.
So, and he has talked about doing the Greenlight too. So I'm trying to turn him onto it.
Well, good. Are you taking new patients at
Always.
Novant Health Urology Partners?
We always are.
And can you provide us with that phone number?
Absolutely. The number is 910-721-4150. And our scheduler, Lena, is amazing. And she is very helpful with patients.
Well, thank you so much, Dr. Lydia, for coming back on the show today. And
Absolutely.
I look forward to having you again soon.
Thanks for having me again.
You're welcome. Our next guest is Stephanie Shoaf, physical therapy assistant with Novant Health. Welcome to the show today, Stephanie.
Thank you. Glad to be here.
It's a pleasure to have you. So let's start by learning what you do at Novant Health, Brunswick Medical Center.
Well, first of all, I've been a physical therapist assistant there for 3 years and just work in and out daily with our patients in the outpatient setting and rehabilitating them, getting them back to normal health. and we are up and running every day helping these patients.
Rocking and rolling.
Rocking
right?
and rolling.
Well, tell me a little bit about your education. How do you become a physical therapy assistant?
Okay, well, I actually graduated from Guilford Technical Community College, and that is in Jamestown, North Carolina, and years ago when we rode on rocks. But anyway, it's just a 3-year program, and the courses are very intense, and when you pass the courses, you have to sit for your state board and that sort of thing. But then you have to work on a physical therapy team. You know, you're under physical therapists, and you carry out the plan of care with the patients and that sort of thing. So it's a pretty intense program.
Sounds like it.
It is.
I didn't realize that.
And I also have an undergrad degree and bachelor's in biology from A&T State University. But the school was great, and we also take students on as part of their education, so you can do a clinical affiliation with us also as a student in one of the programs.
Oh, well, that's nice. How did you become interested in being physical therapy?
Oh, I'm glad you asked that question. I actually was a patient in physical therapy. I was in a car accident in my 20s and needed some physical therapy. Had several injuries to my neck and my back, and actually was pretty intensive therapy that I received, and fell in love with how I got back on track with not having pain every day and able to run and you know, work out again and that sort of thing. And just fell in love with it and decided I was going back to school, and that's what I was going to do the rest of my life. So,
Wow, great story.
yeah, it was pretty fascinating.
Great story. So, I know there are different ways that physical therapists and physical therapy assistants interact with patients. Talk to me a little bit about that.
Okay, well, you know, there's a need for physical therapy for a lot of reasons, whether it's orthopedic, whether it's, you know, just getting back on your feet, that sort of thing. We have a physical therapy team, and I want to brag for a minute about our team. We have about 65 years of experience with our outpatient therapy team.
Just among you?
Among us.
Wow.
65 years. And we have physical therapy and physical therapy assistants that work in our outpatient setting. And the role is to get our patients in. Usually they come in from a referral, but we are direct access in North Carolina, so you don't always have to have a doctor's referral, just depending on the type of insurance that you carry. But you come into the clinic, we see you for an evaluation so that we can get to know you, get to know what your needs are, your physical, you know, limitations and that sort of thing. The physical therapist does the evaluation, and then we as a team together with the assistants, we come up with a plan, and we carry out this plan so that you get from a debilitated state to a rehabilitated state. And we get you up and running and walking and you know, just having your normal routine without a lot of pain and that sort of thing. So,
well, I know that you talked about the number of years experience and the great team that you have, and I can personally attest to that because I have been a patient of physical therapy, and I've been a patient of yours.
Yes.
And I know that it is such an important part of the rehabilitation process.
Yes, it
you know,
is.
I had surgery and had to have physical therapy, and you guys did a phenomenal job. I don't think I would be where I am today had it not been for you. So thank you so much for taking great care of me.
thank you for getting well.
Well, I wanted to have you here today because I understand that you have moved your space. You moved your office. So tell me where you were.
Okay. Well,
and then where you're going. Where you've been.
Absolutely. We were inside our hospital, our Novant Health Medical Center, and now we have branched out into the business, the heart of the business in Shoaf. Our address is, I think, 4503 Main Street. So we're right in the business section in Shoaf. And we just have an individual building, and it's larger facility than we had previously been in, and it's just very convenient for our patients. We see patients from South Carolina, you know, all the way past Wilmington, North Carolina.
Really?
So it's more centrally located, and I think a lot of people know where Shoaf is and that sort of thing. They can also do their little errands and that sort of thing when they're out and about, so it kind of makes it easier. And I just like the fact that it is, you know, located in the business center of Shoaf.
do you have like private treatment rooms there?
Absolutely. We have 3 individual private treatment rooms, and the building is designed where we can take on 2 or 3 more individual private as our business grows, the treatment rooms. But we also have a gym.
You do?
We do, and we also have wonderful staff there that can take care of all the needs for our patients and that sort of thing. And it's handicap accessible. So, you know, a lot of our patients, some are in wheelchairs, some are in need of a ramp and that sort of thing, but it's handicap accessible, and we just love our new location.
How about parking?
Parking, absolutely. You can pull right up to the front door.
That's awesome.
That is awesome. You know, when we were at the hospital, you know, parking was a little bit of an issue for our patients who could not just walk in on their own. So,
well, that's great. And now, do you still have physical therapy services at the hospital?
Yes, that will always be a need. We offer, you know, all types of therapy in the hospital, you know, pre-op and then post-operative, you know, for orthopedics and that sort of thing. But we also see our patients who have had, you know, like suffers from strokes or, you know, just in a debilitated state, just weakness, you know, weight gait abnormalities. All those services are still going to be provided for inpatient, but now we have an individual clinic for our outpatient.
It sounds like it's been a huge improvement in terms of space and privacy.
Absolutely.
And I'm sure that the patients will love that. I know when I was in physical therapy, it was inside the hospital.
Correct.
So I'm looking forward to seeing the new space.
Well, I would love for you to come on down and check us out.
Yeah, I'm going to visit. But let's talk a little bit about at-home exercises. Now, that wasn't one of my favorite things, but I know that's a really important part of the rehabilitation. So talk to me a little bit about that.
Right. Well, as you know, your patient comes in for an evaluation, and then we set up a program individual to their needs and, you know, how we're going to get them back to their normal activity of daily living. And it often does entail of a exercise home program. And we usually start that from day 1 or week 1 of their physical therapy. And yes, you have to do your homework, June. You do have to do your homework. We are not there at home, but we will give you the tools that you can, you know, definitely strengthen, you know, what is weak, and we stretch what is tight, and we give you the tools to do that from day 1. So, you know, when we're in the clinic, we can work on a little bit other things, even though we're still working on strengthening and you know, range of motion and that sort of thing. But we give you tools that you can start with at home too. And then, you know, we can also get into more of the modalities for the pain control and that sort of thing. So, but yes, you do have a home exercise program, and we make it individual for your needs.
Right, you do.
Yes, yes, we do.
Well, for our viewers out there who would like to maybe have an evaluation or seeking physical therapy, how might they contact you?
Oh, absolutely. Well, I'm going to give you your office phone number. I'm going to give you the address again. Our office phone number is 721-3157, 910 area code, 721-3157. And then our physical address is 4503 North Main Street. But to come into the clinic, we are a direct access, so you do not always have to have a doctor's prescription to come in. Certain insurances do require that, so just depending on your insurance. But you just bring your prescription in, we get you set up through the evaluation, and then we determine how many days a week we're going to need, whether it's going to be 1 day a week, 3 days a week. Sometimes, depending on, you know, the diagnosis and that sort of thing, it's 5 days a week.
Right.
And we actually have availability to provide that to our patients now. So, but
well, Stephanie, it's been such a pleasure to have you here today. You've provided us with such great information. I'm happy for you that you have a new space, and I look forward to visiting you there.
That sounds great.
So after you've been there a while, I hope you'll come back and talk to me and tell me how it's going.
I will. Great. I'll let you know.
Well, thanks again. Our last guest is Linda Petrone, Nurse Manager at Novant Health, Brunswick Medical Center. Well, welcome to the show today, Linda. It's such a pleasure to have you here.
Well, thank you.
I am excited to hear what you have to tell me today. But first, Tell me what you do at Novant Health Brunswick Medical Center.
Okay. I am the assistant manager in surgical services.
Mm-hmm.
So I'm there to help patients get ready for surgery and take care of them after surgery.
Okay. And tell me a little bit about your education and your background.
Okay. Well, I was born in the South. I was born in Florida, but I was
Really?
raised in Brooklyn, New York.
I can tell.
I went to a diploma nursing school at Kings County, which was at the time one of the largest municipal hospitals in the nation. And then I got my BSN, my bachelor's in nursing at CW Post. And then I got my master's in nursing at Lehman College, which is part of the City University of New York system.
Wow, lots of school.
Lots of school.
Well, how long have you been here at the hospital, Linda?
I've been here since 2007. We moved here from Raleigh in 2007.
Oh, so you've been here a while. Mm-hmm. So you've been here for the growth.
I've seen a lot of changes.
Yeah, absolutely. Well, today we wanted to talk to you about something a little bit different. So it's my understanding that you recently went on a medical mission trip. So I would love to hear about this. I don't know too much about medical mission trips, but what I do know seems pretty exciting. So tell me about the organization that you're involved with.
Well, the organization is GHO, or Global Health Outreach.
Okay.
And it's an international mission program, and it's to provide health care while spreading the gospel. And they do this by sending in medical, dental, and surgical teams all over the globe.
Really? So where did you travel to?
Okay. We went to El Salvador.
Wow.
Yep. And it was we flew into El Salvador, and then we took a bus ride 4 hours to a little town called La Union. And that's where we were associated with a church and a school. And that's where we set up the mission, the medical mission.
So in terms of medical care, what did you do?
Okay. We provided dental care. We provided lots of eyeglasses, over 600 pairs of eyeglasses.
Do you take them with you?
Yes, they're all donated. What I was in charge of was setting up triage. My background is also I've worked in emergency medicine for 20 years.
Okay.
So I was in charge of setting up triage, and in 3.5 days we saw 1,600 people.
Wow.
So, and it was always over 100 degrees. It was hot, hot, hot.
Oh. So when you say you were in charge of triage, does that mean that you looked at every patient?
Well, there was about 10. There was many of us coordinating them from anywhere from they were just volunteers or med students or physical therapists. There was a lot of health care related professions there. So we set up little triage tables, and every table had an interpreter. It was usually a junior or senior from the high school. Their English was excellent. I was a little fortunate to go because I went with my daughter, and she is a Spanish teacher.
Oh, wow.
So it was a great experience for both of us. So she was actually my interpreter for the triage.
So what kind of questions do you ask? What do you find out at the triage
Well,
table?
the main thing we asked is, what are you doing here? And it got to be everyone kind of had the same ailments, backaches, weak, and all the parents would say, my kids are tired, And basically what it was is they just wanted to see the American medical team. They wanted to see the American doctors.
Really?
So everyone had more or less the same complaints, I mean, there were some really sick people there. And being on the other end of it, thinking of, from an ER perspective, emergency department's perspective, I would have had some of those people right back to a bed and had a doctor looking at them, but I couldn't do that here because the healthcare system is so different.
Were there any surgeries performed during this medical mission
We
trip?
did. They do not on this trip, but they do surgical missions. But we did do 94 dental procedures. We did extractions and those types of things. I'm
curious, what inspired you to do this? Had you done this in the past?
No, I had always wanted to do that, kind of to give back, and never really. And I always thought an opportunity will, arise that I would take advantage of it. In the last couple of years, I met a physician who's become a good friend of mine. He's from Greensboro, and he has done this, been with this organization for about 8 years.
Really?
So he's an ENT, and he asked me if I wanted to go with him on this trip. And it was during the summer, so my daughter could go too. So we said, sure.
Wow. Well, tell me about the conditions there. What did you find?
Well, El Salvador is the smallest of the Central American countries, but the most densely populated. In the last 80s and 90s, they went through a civil war. So they're in kind of rebuilding phase, I would say. But especially where we were. El Salvador, of course, is the city, but in La Union, extremely poor.
Really?
There were some people that would walked 2 hours in 110-degree heat just to see us. Wow. You know. So it kind of makes you very humble to realize what you have here, how much that we have here as compared to them. And they were very happy people.
Were they?
They were very happy people. And parents, no different than you or me, you know, wanting the best for their kids.
Sure.
So, you know, they'd bring their kids just to make sure everything was okay, even if there was nothing wrong with them, you know. And the kids were great. They would come around at the end of the day and they would practice their English.
Oh, yeah.
So they would say, you know, they would say something to us and they'd say, ask us something, you know, and we were there actually for 3.5 days, and you really get attached to these kids, you know. But very grateful for anything that we could do for them.
Sure.
You know.
Where did you fly out of? Did you?
We flew out of Raleigh.
Raleigh?
I went Raleigh to Dallas, Raleigh, and then we met up with most of the team. There was about 14 of us that met in Raleigh. And then I think it was Dallas, I can't remember where we connected, and then we flew to El Salvador.
How long is that flight?
It was like...
Take you all day to get there?
Yeah, basically. You know, between the stopovers and everything, you got there by dinner time.
Yeah. Now, tell me again the name of the organization.
Global Health Outreach.
Global Health Outreach. If people were interested in maybe doing a medical mission trip, do you have information that we could
Well, they have a great website.
Okay.
So if you just go to Global Health Outreach, there's everything on there that you would need. And actually my friend, that's how I did it. He just told me where to go to the website, and they can give you information about how to sign up and what trips you're interested in.
Do you have to be a doctor or a nurse?
No, not at all.
There's all kinds of
positions.
that...
We had some women who were just kind of had a daycare and took care of all the kids and did arts and crafts with them.
That would be interesting.
And we had another fella, he was a big exec from some company in Tampa, and he organized the eyeglasses, which when you give out 660 pairs of eyeglasses, he organized all the kids and everything like that. So
wow, that's
there's
awesome.
Something for anyone who wants to come.
Are you going to go again?
I am going to go again. I think the next time I go, I want to do a surgical trip.
Sounds good. Yeah. I think maybe I want to go with you next time.
That's great. Come on, come aboard.
Let's talk about that.
We will. We will.
All right. Well, Linda, it's been a pleasure getting to know you better and learning about your medical mission trip. And I look forward to talking about another one that maybe I'll go. And then we can do another show and we can talk about it together, okay?
Sounds great.
All right,
Thank
great.
you.
Thanks for being here.
Thank you.
Thank you for tuning in to ATMC TV's HealthWatch. I hope this information was beneficial for you and your family. If you have any questions or topics that you would like to see discussed on a future show, please email them to atmctv@atmc.coop. Please visit NovantHealth.org for more information on Novant Health Brunswick Medical Center, local physicians, and general health information. Thanks again for joining us today. Be sure to join us next time for HealthWatch on ATMC TV.
We or ATMC TV, Channel 3 and HD Channel 910, your community channel.